So it's very nice to have Professor Dr. Sunil over here. And then, we were just wondering, maybe you'd like to start off your initial association with this institute.
My initial association was with Wadia Children's Hospital. I did my MBBS from G.S.MEDICAL College, Pune. Then I joined pediatric department there, but unfortunately I didn't like it for the simple reason there was no teaching. And it would be just monotonous thing going on over there, so I decided I better not continue with pediatrics. Then there was an advertisement for a house physician post at Wadia Children's Hospital. I applied for it and I came for an interview. Dr. Bhagat took my examination. It was a case of poliomyelitis and he asked me to examine the case, detailed examination and all, and he immediately told me to join. So I told him, first give me 7 days, I have to go back home and tell my parents and come back. So I came after 7 days, I joined under Dr. Bhagat. Dr. Master was his assistant and Dr. Bhagat was...
That was in Wadia, is it, madam?
Wadia Children, but I registered for MD at G.S.MEDICAL College, that was at KM Hospital.
When was that?
1964. And I completed my post there. Dr. Bhagat was head of the department, and I can say one thing about sir was that he was not only a good teacher, a disciplinarian, but he was like a father figure to all of us. He not only taught us pediatrics, but he taught us how to behave with your colleagues, with patients, with their relatives. And in fact, I owe everything to him today. Even my doing neonatology, for which I went abroad, and I did, it was entirely because of Dr. Bhagat that I took over. There was one thing he taught us, and that was, please be honest to your patients. And in fact, there were quite a few times when, like Maruk said, that somebody tried to put you down and somebody tried to put you up. But he knew his people, he trusted us. And if anybody did say anything, he would be like sitting in an inquiry and trying to show that my students or my residents will never do something wrong as far as patient care went. And I went through it, I learned a lot from that. And one thing I knew about it, that patient care was prime, and then second was teaching. So that is one thing I learned from him. He was a fantastic clinician. Today, whatever I go or whatever I do, or whatever my clinical thing is, which I carry on even now, is entirely because of Professor Bhagat. I did my MD. During my MD, Dr. Bhagat was there, and I was very much interested in newborn because Dr. Master, who was assistant to him, she was basically taking care of newborns, which were in Wadia Children maternity home. And I used to take rounds with her. And she just told me that nothing doing, even if it is in the middle of the night, that you have to go and look after the babies, you have to go. So many times it would be going from Jarbai Wadia to Naurosi Wadia in the night, 12 o'clock, and I used to remain there, not come back to Jarbai Wadia because that was something middle of the night walking down the road. So we started a newborn unit there separately with Dr. Master, who was looking after. And then there was a meeting with Dr. Kothari, who had come from UK. And Dr. Bhagat told that you attend the workshop and all, and during that workshop we were presenting cases and showing, and Dr. Kothari that time asked me, would you like to come to UK and do a fellowship in neonatology? I was in two minds because I wasn't very sure. When we are so young, we are not very scared of going to abroad and what to do. But then Dr. Bhagat really gave it to me and he said, you go ahead. And my father wasn't keeping well, so he said, you don't worry about him. I will see, I'll look after, but you go. So after completing my MD, which I did from Wadia, and I went to UK 1970, I did my fellowship in Bristol, Southmead Hospital, and I worked over there. Then I went to States at Florida University, Gainesville, and there I did on respiratory distress some research. I joined there with my all neighbor in Jacksonville Hospital, and I was in two minds of continuing there, but Dr. Bhagat from here told me, because at that time we had to do ECFMG, but I had a very good recommendation from Dr. Connor and Dr. Peter Dunn, so they took me over there in States. But then I got a message that my father wasn't well. So I decided I'm going back. There was no looking back. Many people did dissuade me that you are making a big mistake and you are losing a very good opportunity. But I had one goal that there is nothing lost coming back. So I came back. Yes, I lost my father after that. But then I joined and I was still in Wadia. But Dr. Bhagat was all the time after me, like he was practicing at Sanders Bridge. And Dr. Amonkar's nursing home was on the third floor, he was on the second floor. So I used to visit, I was staying at Grand Floor, so I used to visit there. So Dr. Bhagat used to send patients to me that, okay, you can start something. But I would not charge them or anything. So one fine day he got very angry with me and he said, okay, forget it, you just stop practice, you will have to get into a full-time job. That time there was advertisement of assistant professor of pediatrics, which was with KM Pascal. I joined there as an assistant professor of pediatrics. That was in 1973. But then my whole this thing was on newborn. So I applied for a professor of neonatology, and I think Dr. D.SUPE was there. He saw my biodata which I had, and he immediately said, hey, you become a professor of neonatology. So I became a professor of neonatology from 1977. Initially my experience here wasn't very good. I had to work with Dr. Parucha. Though I used to go practically every day to Dr. Bhagat, and I want to go back to Wadia. Dr. Merchant kept my post vacant. He said, I'll keep it vacant for you for 6 months. Anytime you want to come back. But it was Dr. Bhagat who sort of did not want me to this thing. He said, no, you continue, things will happen. And it was a very stormy time I had, and Dr. C.K. Deshpande was the dean at that time. And I went to him and I told him, sir, I don't think I can work under her. So he told me, he gave me an option. Dr. Pai was in community medicine at that time. So he said, you do like this, I'll give you a short time posting of social pediatrics to work under Dr. Pai. So I said, okay, it was an alternative. So I took up that post and we developed quite a good this thing in the pediatry, Malavani and midday meal, and I had gone to Hyderabad and did my nutrition course over there.
NI.
And when I came back, Dr. Palliattive was there. So together with Dr. Palliattive, we started the midday meal in that Malavani school. We had parents, we made it a point to see that they would come and help in cooking it. And I think that got a recognition from British Council, and Dr. Palliattive had gone to UK for it. I worked over there, and then of course Dr. Parucha retired. I came back to the Department of Pediatrics there. But when I joined as assistant professor, I still remember saying that Dr. Bhagat told me, look, now you are like a professor now, so you can't move around with your dress, you better start wearing sari. So I told him, sir, if I wear sari, I will not be able to work. Because that is something, it's a beautiful garb, and I know it is something which is very nice, but I just can't move freely. So he said, no, otherwise how will people respect you? So I said, sir, people respect you for your work or for the clothes you wear. So for that short time, he was very, he didn't say a word to me. But I carried on work. After 10 days, he called me and he said, no, you wear your dress and you work. It's okay. I've come to know what is happening and all. So I continued. Maybe I'm one abnormal person still moving around with a dress everywhere. But I'll never forget this when he told me, and when I told him that, I told him this, work is more important or wearing different types of clothes which are very important. But then I had a little bad time even in the Department of Pediatrics, where the pediatrician did not want to part away with newborns. But I am very grateful to Dr. V.N. Purandare, Dr. Usha Krishnan, Dr. Choklekar, and the whole department of OBGY, they were all with me. And in fact, Dr. Purandare gave me a place in the postnatal ward. And he told me, you develop whatever the space is there, I give it to you and you start your little thing.
That's what, 14?
I think yes. You were there with me, Rahul? Rahul was my student. I still remember he came to me and he said, I'm your postgraduate student. I have come with. I said, so what? So well, I mean, that was my first encounter with him. It was quite a... But I must say one thing, that all my students, I mean Rahul, Vanna, Sachin, Kalpesh, I mean Cyrus is there, Sandeep is there, they've been wonderful people. But I must mention two people, Samir Wagle and Suhas Kalam. These two people were with me when I was in 14A. I mean, I had a drudgery time going through that. And the only request I was doing, asking the pediatrician is, you are most welcome. This is not my department or my this thing. I'm looking after the babies. But to prevent some controversy with the nursing staff, I will come and say, give this. Somebody else will come for the round and say, you give this. So change the order, and the nursing staff were getting confused. I mean, it was something which I was trying my level best to break it, but then of course I persevered, and I think Dr. Purandare put his foot down. And he said, nothing doing, all our babies will be seen by Dr. Irani. And my whole unit, all of them were with me, Rahul was there, all of them. But there came a time then we had, see the KM hospital, the old building, the whole construction was very, very old. The pipeline and everything was very old. So we used to get a lot of infections. And one fine day there was an epidemic of pyogenic meningitis.
There was what?
Epidemic of pyogenic meningitis. All babies had, I mean it was so bad, you know, it was very sad. I mean looking at it, I mean back I felt, you know, we were all feeling bad. I mean day and night I can say that one thing at least I am very grateful to my students. And because of them, I was able to do what I did at that time, was they were with me all the time. If I said that this has to be on, please remain there, so they will be there day and night to look after. But then we just could not prevent that. So we had a big investigation going on, where does this infection come from. So we went right down to the labor room, which is right down to the Ward 14A. And we went through the drainage, and there were horrible salmonella and all picked up from those pipelines and all. So then we said that, I mean, you have to change it. There was no alternative, otherwise this is going to worsen. At that time, we had a whole, write-up in the newspaper, and big blah blah was done. And Sachivarya, they would say, give a query, what has happened and all. So of course, we found out the root. But then we followed up. We went from door to all those cases which were discharged from our unit, and we saw what was happening to them and how they were doing. So we made a report of all that we followed them up, and so we put it up. Following that, there was, because of this, Dr. G.S.MEDICAL sir was there. He decided that why not, that time the new building was coming up. And I put up this thing that I would like to have one whole floor so that I can shift the whole neonatal unit over there. Again, there was a big uproar of why should the whole floor be given for neonatal. So then it was decided that half of it should go to intensive pediatric care unit and half will go to neonatal unit. So I said that if that is so, then you have to come and see everything over there. I'm not going to take responsibility for the pediatric side. Then they said, no, we will shift up. So I said, okay, then you shift the whole ward, which is ground floor. I'll take my neonatal unit on the ground floor. That was ward 1 at that time. And I'll make one, because right at the corner initially we had small nursery there also. So going through it, I said, it's okay. You can go up and I'll look after the whole thing over here. I'll build up over here. That also was not acceptable. So then I decided, then I think of course Mr. Madhuskar was there, he was our deputy CEO there. And we had a horrible time because nobody was ready. Dr. Bharucha, who was an assistant professor with me, and he was a wonderful person, great help, I must say. And he really helped me out also many times. So what we did was, there was one DMC, some twins were there, and they were looked after. We took the side room of Ward 1, and all of them helped me out. Bharucha was there, he used to be on call, I used to be on call, and sometimes till 6 o'clock or 7 o'clock we would be working over there. And unknowingly or knowingly, we didn't know, the message went that the only person who works in the department of pediatrics, this is what I was told, is Dr. Irani and her unit people. So I got this thing. That time then came Mr. SUPE, and he gave an order and I still remember, I saw it with red pen, it was written in this thing, that the whole department of neonatology should be shifted to 10th floor. What better floor that I wanted? They gave me only 10th floor will do. I said, okay, give me 10th floor. That time, Dr. Suhas Kalapur and Samir Wakre, all of us, I mean 3 of us were literally shifting luggage, bag, whatever it was, we moved, which was just so they will change the order. So my test was shipped. So we took our own warmers and whatever little kids and all, we went and shifted to 10th floor. Now, right from first floor, I think there was creche which we had created for babies there on the first floor. That was also we created over there. And I think Shivsagar's pharmacology, this thing was there. From there up, there was nobody. The whole building was empty. And then our nursing staff said, we are scared in the middle of the night, anybody, and that time some Shivsena Gundas also had come. So what I did, that I took a lock and I used to lock that door. And one of my lecturers would stay back in the night. Initially I stayed till 7 or 8 of them. They said, no, you please go home, we will manage. So practically for about 7 or 10 days, my lecturers would stay alternatively in the night so that the nursing staff should know. And that's how we slowly managed. And I mean, of course, we got quite a few donations for equipments and all. How, I won't say stingy, but I would say how you draw not to give this, not to give that. So we got a lot of help from people. We got radiant warmers and all set up. Then we made one whole room for our, this was whole basically inborn, front phase. And then we had transition and outborn, and then one very small room we had that time for ventilator. What I have seen now also, of course it is redone, but as such they have made a big plan where we used to sit. I had made it a point wherever I used to sit that my lecturers should sit in the same place. And we had a sofa over there, I still remember. And I remember Ganesh had brought that Ganpati's murti, where every day we used to enter our room, we used to first do puja to Ganesh. He had brought from Halibut. He stayed away for 10 days and I fired him, go away, you have no right to. So he said, I stayed there for 10 days to make this Ganpati statue for you. So now you cannot tell me to go away, I'll never forget that. But then, yes, that statue is still with me because he insisted. I was going to keep it back. But then he said, no, I brought it for you, so I took that and it's still with me in my house. And then we started slowly. And we had a very good response from the obstetricians who were there. Rahul was there, Anupam, we made a trip, we had a research. What I want to say is, whatever we did it with all our heart and soul. I mean, it was not something that somebody is telling us to do. Like, this was of course WHO and SIDA research that was being done. We took a lot of pain, and I must say one thing, whatever was started, we were monitoring it throughout. Whether it was patient care, whether it was some equipment which was given to us, or whether it was any financial assistance which was given, we used to make it a point to see that everything was in black and white. We made it a point to see that all my students, they went through whatever conferences were gone. I used to tell them, please attend. Then whether they had to go abroad, Rahul was my first person that we managed to see that he went abroad to study. All of them have come back, and I'm very happy. They have really established themselves in private, but I must say that each of them is really doing service for the. It's not that money making is the main. Maybe yes, in private you may get something, whatever is this there, but patient care is more important, and that is what I felt that should be the mainstay. What we did in neonatology, and I'm very happy with it. I mean, I thought at that time it was the best unit in the country because elsewhere it had not started. After us, it was Chandigarh where it was started, and I still remember going for taking DM neonatology exam to Chandigarh. That was the second one. Later on, of course, it's everywhere. But as far as Maharashtra went, it was our unit, DM neonatology also first started here, then it was at SAN, and now of course it's everywhere. And Rahul is there in Bombay Hospital, doing good service with patients and all. So, I mean, I've just traced back the whole journey, how I started, how I had to literally make my way. I mean, lot of obstruction, but I had made up my mind. My mind was this patient care number one, and then they should learn proper thing, right thing. That is what I still do also. Correct thing should be taught to them. I do agree that there is Google and all those, but I still don't think that is giving them the insight of whatever the main thing is. All MD exams are given, you are asked the paper, there are 4 lines or 5 lines to do, that is traced right from Google. But if you ask them, why does hypothermia cause hypoglycemia or hypoxia, they will not be able to tell you. Now that is what we were taught. We were taught basics. Why? I mean, I still remember Dr. Bhagat telling us, it is, every time it is why. It is not that you read something and give, why does this happen? Why should the child go deteriorate? Like you're saying that malnutrition, I'm now working in the field, and I can tell you, it starts right from 6 months. See, when we are tracing back, we have done a lot of community management of malnutrition in Nandupa, that is our CMAM program. It starts right from 6 months before that. And if you look at the hospital work which is going on, nobody bothers. No one talks to the mother, no one counsels the mother that breastfeeding should be continued. So by 3 months or 4 months, something is introduced which will be watery things. This child starts going down. By the time he is 1.5 years old, he is already starting. So malnutrition is prevalent. There's 5.9 million children in Maharashtra, this country is there. So you can see how bad it is. It has not gone. Tuberculosis is back again. And if you really go into the depth of everything, into the tribal belt, it's very much there. So something, if anybody wants to say prevention, I always say that start breastfeeding right in the labor room. So what we are advocating is abdominal delivery, which at that time our little baby cord was clamped. Now we put the baby on, and then of course KMC is there. KMC is also another very good thing of prevention of hypothermia, feeding and all that. So, you know, when you ask what is training or teaching of the students today, I am very sorry to say it is very bad. Because many of these medical officers who come right there into the district, they don't know the basic things. You know, it looks as if I'm teaching again. And that is what is happening. You know, I feel that why should I? But then I say they really don't know. That means what is happening at this end. And whatever it is, I know that they are allowed professors and they are allowed practice. But if you ask students, you will get the answer. The professor comes, takes the round, and they are left to either senior students or lecturers taking, which they are really not taught. Because when I was in Somaiya Hospital, I used to get students from KM Hospital to come and attend them. So this is what I learned from them. I mean, I don't know anything here, but they, you know, it is a practice. They say they are giving tuitions. I don't know, we never knew what was tuition at that time in medical, you see. But somebody gives tuitions in medicine, in surgery, and of course I asked for pediatrics, that was not there, but that started. So why it is happening? They don't spend time with the students. I don't know whether something detailed, like we used to take clinics, my God, it used to be why this is happening, what sign is there, why liver is enlarged, why this is happening. We used to go into the depth of it so that the student knew exactly what was it. There was another thing, why doctors are being beaten up and this. We never, did anybody beat us up? Did anybody shout at us? Nobody. Why? Because we were all that time talking to the relatives. See, in fact, in our nursery, we had the mothers or the fathers coming. We used to tell them, this is what has happened to your baby, this is happening today, this is what we are giving. I mean, they were completely aware of all that. So, in fact, if something went wrong and the patient died, the mother used to tell us, "आपने कितनी मेहनत की आप लोग ने, भगवान को नहीं चाहिए तो ले लिया." I mean, that was the attitude, that was what was happening at that time. It is not happening now. And even the students don't know. I mean, I just don't know what to say. You know, sometimes you feel bad. This is what is happening. In fact, I tell you, don't take medicine. Very honestly, I say okay, it's better you go into something else or go to some place where it is properly taught. Because I've seen this happening, what is happening when I see around, then it's very sad. But when students tell you this, it reflects badly on the senior class which is there. So what to do? That is sad.
Madam, I remember one thing you said about social pediatrics. Actually, once Dr. Bhalera had told me to ask something about nutritional rehabilitation center at Malavani. I came to your ward and waited, and then I went back. I said, madam is not finishing her rounds. She said, "Ti samadhi lagte tila." That is how I have known about
once
your rounds,
we
madam.
really take each child detail we go to. Right from history, and believe me, history gives you such a lot of things. Like you said, malnutrition. If you just get a history that your child was low birth weight. Now, if you tell me nobody will know the birth weight, okay, so then you ask her, was this child given to your कांच की पेटी में रखा था कि दूर रखा था? That much history is relevant to tell you what is happening, why this child is not growing, or what intervention you should put into that child's thing. But that is not done. I don't know, somehow it's lost. It is something where people don't connect to it. If they have to do something research on feeding, they will feed. Okay, so special milk is there, special this has to be. But they don't know that this was full-term baby, or what was it, what was the weight at birth. I'm putting in so much, but this child is not growing. He will not grow if it is small for him. But that sort of a thing should be made known to them. So these are certain things I find it's lacking in today's very stick short. Like when I was in Somaiya hospital, here, when you say good morning ma'am, good morning sir, as I said, I won't say sir, I would say just call me by my name or say Dr. Irani. No need to say madam or this thing, which I learned in UK, and that was one big shock to me. Over there, we used to say ma'am, so Dr. Connor took me one side and said, see, your sir and ma'am, you do it in India. Over here, you call me Baron or you call me Dr. Connor. Same thing with Peter Dunn, so I used to call him Peter. I came back over here and I was called by Dr. Deshpande in the office and said, there is a complaint against you. So I said, sir, what? No, not about your work. So I said, what is it? So he said that you are not sirring. Huh? You are calling by name. So I said, oh my God. I said, God, over there it took me time to cut off sir and make this. I said, no problem.
used to say, madams are on brothels.
Yeah, absolutely. That's what Beryl told me, don't call me madam or anything. So I said, okay, from tomorrow onwards, I know what to do. So, some small things which come up. So when I was in Somaiya hospital, the student used to say, hi ma'am. So I said, hi. Because I realized you have to move with the time. You can't sit back and say, call your name and all. Then you were talking about dress of this thing. Yes, today's generation, they have pants and short. But in Somaiya hospital, it was regularized that you will not wear sleeveless. And you will not have low necks. That was the dress code which some of the students objected, but they had to follow. Because there are certain times that when they go for Nala Sopara, they went for internship. Now those are all tribal people. So these girls were having low cut, this thing. So that fellow grabbed that girl's hand, It was a big hangama and who had cried. And it went, parents made a big case and all. So I know that time that I gave Mr. Ahir was there. So he gave us, what did he say, these poor tribal people, they have not seen girls like this and dresses like this. Thoda aisa kya to kya hua? Yes. Yeah. So we put a foot down. No girls will go to none of the tribal area. If that is an attitude by the health minister, forget it. See, these are certain things we have to understand, but dress code is important. I always used to say, wear your coat wherever you wear. Because if by chance, if any relative tell you, it's your fault. It's not his or her fault. So at least all our residents, they always would wear a coat wherever they went. So discipline, yes, maybe I was very bad disciplinarian, and there are incidences which make me laugh now. But I was in we had a false ceiling which we had done, and we made central oxygen, central suction of our nursery. So I had a habit that whenever I entered the room, I never used to first go to the cradle. I used to move my hand on the wall and ceiling and AC and see that everything is clean. So all these people, I mean those from Aurangabad, they were there. All these people said, today she will have no chance of saying anything, So I entered the thing and I just looked like this up and all, and through the falls, that asbestos was, but I could see a tail. So I walked out, and that time Sachin and Kalpesh were there. So they said, Abhi kya ho gaya, So I went down, took the lift, went down, called an engineering fellow and told him put a negative suction, down base. Because one thing I did was, whatever was said, I used to tell them, you must go and see. There was nothing like this, usko bola. You must know what is what. So each of my, they went to that bioengineering, they also knew. So Sachin and Kalpesh were standing behind me and said, Abhi kya ho gaya? They get the lizard, cockroach, all these things were in the plate. So when I was there for that, so this one of the students from Aurangabad said, Madam, आता मी तुम्हाला काही सांगणार आहे. So I said, काय? Oh, we call you मांजर. कुठली मांजर आहे? कुठे कुठे बघते? I laughed with that incident. So I said, see, now when you are working, you will take care. You will see that your nursery is very clean and all. Because these are things, I mean, one epidemic of salmonella drove us mad, I mean, it should never happen again. So these are certain things which we did for the institution and nursery, and I'm happy that it's still going on. DM is continuing, and as I said, it should continue in the best possible way. Students who come out of it should really know their stuff properly, so nobody should point fingers. Like all my great boys are here, all of them all over, and I always say that each and everyone is so well stabilized and they are doing their work so well that I say touch wood, be happy. There was only one thing which I must say. I think Rahul, that time you were not there. I used to go, they used to call me for giving talk. David Hardy used to call me in the UK. So I mean all experiences which you get from the community and all. So one fine day he told me, I want you to come for dinner to my place. And I mean their place going, it was like, I said, no, please don't worry. I managed myself. So he said, no, I'll come and pick you up and I'll take you back, no problem. I thought they better not say anything, okay, so I went. So as we entered his house, there was a porch like that. Then he opened the door. Then I entered, there was a room, and the second door opened. And I saw 10 of my students over there. All these, everybody, like, all bachus, I was hugging them. I was literally had tears in my eyes, And he told me one thing, that, Sunil, when any of your student is on duty, I can sleep peacefully. So I said that was the best gift I could get, and that was something which I am very happy with all of them. All of them are very good, very well stable. In fact, I think in 91 or 92, our neonatology department was adjudged as the best department in this institute. You can see all those data will be there. I was given also as the best teacher in the thing, and one was in the pediatric department. So I was very happy that everybody recognized our neonatal department. We really trudged through, and some wrong thing also we did was harboring 2 kids with us. And I still remember Dr. Acharya shouting at me. That's Sony.
1 year plus.
1 year we celebrated. She was brought from a dustbin,
Harboring means you get the children with you till what age?
1 year plus.
We celebrated her. She was
But they were taken to
loved
the pediatric
by, she was in the PNC ward. She was in all the round taking. She could imitate me so beautifully. Barjor was one person who could imitate me. I can never forget. He would just turn around and say, hey, bye, utha, tu kai Cleopatra hai kai. He would always say that. And this little talk, I mean, I would take her round. I used to put my hand behind. And I would ask, yes, yes. So she would stand there and she would imitate me, And then she would follow me. Dr. Satoskar, she would walk with me everywhere. Everybody knew this woman. Satoskar said, hey, tila kaat, ya ugly lakdi maja, hicha loko aantila. Satoskar You won't believe it. If she would come till that door, she would not enter Sakoskar's room. She would sit as a thak karke bench. Otherwise she would go in More's office and sit there, but she would not enter. So I told Dr. Sakoskar, don't do like this, no. So Acharya madam was also saying, Kai Simen, kasala tila gyon firte. I said, I'm not, she's following me, what to do? Then I asked Dr. Satos, can I take her home one day? He said, no, don't do something wrong like this. And then another one was at Soho. He was at meningitis, all grade mark and all, he was in our embassy. So I mean, whatever best we could do, we did. And I am happy that all of them learned best way and they are doing very well. And that is the gift I have. I mean, whatever anybody says, whatever, I said, I have so many children and all of them are doing well. That's the best thing I could have ever asked for. That. Yes. What was it?
Which year all this migration took place?
From
pediatric to neonatology.
It was slowly going on from 14A. That was like 81, 82.
Recognition.
DM came, I got professor and head of the department in 91 when Dr. Kumta retired. And then DM we got it in 94. I just missed by this thing, but 94. That was DM neonatology. In fact, Chandigarh, Dr. Baku's came in just 1 year before. But as far as the layout of the unit and all went, ours was considered the best at that time.
No, where officially pediatrics and neonatology separated up?
94. I was heading neonatology and pediatric both from 91, 1993. Then 94, DM got recognized. Then separated off. In the last 93, last period in 94, 95.
Some experience with your colleagues?
What experience? I mean, all of them, like Maruk was there.
Well, let's talk about Dr. Kumta and Dr. M.K.
Dr. Kumta was, I will use one, very possessive. He felt that everything should be my thing. So when I moved out, and it was that I am professor of pediatrics and under Dr. Kumta, he was very happy. He was very happy. He never interfered, let me tell you that. But I had to move out and keep separate, he did not like it. And that Dr. Deshpande knew. Dr. C.K. Deshpande, he told me, you just go on doing your work, I will come doing my work. But he never interfered. See, that means Dr. N.V.Kumta, head of the Department of Pediatrics, Dr. Simin Irani, professor, and then of course Dr. Barjor was there and all. So he never interfered. I know that Dr. Kandot and Dr. M.D. Shah were instigating him that we want also and also. I told Dr. Kumta, everybody is willing, but they will not change any orders. That was laid down. Nobody will change any orders. I don't want my nursing staff to get into some confusion. He never bothered about that. That was there.
Is there any neonatology now?
No.
DM.
DM. Yeah, DM is there for a long time. Yeah.
What about Dr.
Barjor? Barjor, what do I say? Barjor as a student. He was an undergraduate student. And one thing about Barjor, he was very honest, very good worker, very dedicated. In fact, this thing of taking care of people, his mother, his sister during his illness and all, I mean, wonderful. But Barjor was a smoker. And he used to sit on that railing over there. I used to come. And the moment he saw me, he would put his cigarette down. And I could get that smell. So I told him, you will not work, at least with me, if you are smoking. So for quite some time, he left. That is what I thought. Huh? But everybody came and told me, ma'am, he is smoking. He will, when you are not there or you are gone away, no, he smokes. So I had a long chat with him. But Barjor was a loner. I mean, he was like his mother, but Barjor was a very strong hand for me. He used to visit neonatology department every Thursday. I used to take pediatric round on Thursday, Barjor used to take him. He was very good in all his, what you call, genetics thing with Dr. Kumta. All that research lab which was started with Dr. Kumta. And Barjor was, in fact, I could not do genetics, and I really, very honestly, something which I feel I cannot help out. I mean, okay, I diagnose, but what can I do? I can advise and do genetic counseling and all that, but that was not in my blood. So I pushed Barjol into that, and I moved out, and I was allowed to move out because Barjol went over. But he was a very good help. His death was something which I don't know, it never got out even now many times. It was really very helpful in many things.
He died when
Yeah.
I know, in the hospital he died.
Outside the team.
He
After argument with Dr. B.
Dr. B. I like it.
No, Dr. B with the Venus.
But that was very good. Very sad.
One more, madam, last one. You still continue your association with community pediatrics. So
Yeah,
your work.
I don't know whether you know Mangesh Gadri. He was from Kenya.
Yes, I know him very well.
So Mangesh,
He's our student.
Yes, I know. So Mangesh is actually now a UNICEF officer.
Right, madam.
And he is in the Bombay office. I think he comes and meets.
Yes,
Mangesh is very close to me.
Yeah.
In fact, many of my email part, like initially I used to trouble Rahul. So now Mangesh looks after more. I am no tech savvy. I openly say, though I get things from them. I mean, I'm up to date with many things because I get all the recent. Maybe probably you all may not get, but UNICEF gets the recent things, and I write October 16 or write January now WHO. I get all those data, which is printed out and given to me, which I go through. And Mangesh is with me. He comes with me on many of my programs in Nambubar, training programs like NSSK, and we do NRC training on malnutrition. And he's a very good one, very good, very honest. And so Mangesh is with me. Yes, I did start with this with Dr. Bhalera, which was and she was in Somaya, and in fact she called me, she said, you have to come here, we can start in Somaya also. So, yes, I'm still with community. We have started 36 SNCU, 36 district of Maharashtra. We have started an SNCU in those districts.
Right,
And
Started what?
Special newborn care unit. But we don't have ventilatory support till CPAP. They are doing it, and we have a very good setup in the labor room. Abdominal delivery, we have started all that, we supervise that, and we trained all the nursing staff and the medical officers, complete newborn care, which UNICEF has asked me to take care of, so I'm care of. So I'm doing it, I think Rahul alcohol in many of my trainings now I do that. But very good training is on nutrition rehabilitation. I tell you, if you really look at Michael Golding, we are talking of giving food. But there is such a lot of physiological change in the body of a child. That's why there is loss of appetite. Unless that is brought back, they don't gain weight. So that is a program which UNICEF is doing with Government of Maharashtra. And it's quite well taken up, and now it will spread all over. We did it in Nandurbar, but Government of Maharashtra is taking over all over Maharashtra state at least.
They are even building a nutrition policy of Maharashtra.
Yes, that is of course on. But the chief secretary, he doesn't know anything about nutrition or anything. He's going to go away in June. So somebody has penned out. I mean, I'm sure you know Sankhya or somebody.
Right.
He's put up a comprehensive.
Sankhya.
He's put up a comprehensive nutrition feeding policy, right from children to geriatrics. Now I said, how can you mix a child, which is a building up thing, to the geriatric thing? But they don't want to. So we are not with it. We are going to do our infant and young child nutrition.
IYCN.
Or now we call it mother and MIYCN. So we don't follow that policy. Because he's put geriatrics, more importance is to geriatrics than. So I just told him that what are you worried about a 70-year-old who may live for 10 years or 20 years or maximum 30 years? What about this little one? Right from there to 70 years, nobody is bothered about that child's proper feeding, but they worry about that.
I think, madam, your inputs they have taken also. The other day
I refuse to go for that meeting because they cannot tolerate something which is told to them which is right.
I think they have taken it up. They have said also in last meeting They of course mentioned your name and
I am a controversial person.
If I'm not mistaken, you are also the first lady president of National Neonatology Forum.
Yes, I was. In fact, I was
First lady president of?
neonatology.
National Neonatology
National
Forum.
Neonatology Forum. In fact, I must say first lady to churo, but with first starting of neonatology, we started in 1980.
Yes.
So that was a small group. From 1980 till I think 84, I was what I would call it, editor, writer, clerk, everything. We never had anything. So I used to write down, jot down. Santosh Bhargava was president. So we worked on to build up neonatology was something, you know how it is. But that time also we included obstetrician, nursing staff. In fact, KM nursing staff, I got them enrolled. And I said you have to be a member of it. And now of course it's a flourished of big body. Then we started Maharashtra State.
Yes.
That also, I mean there are many bodies that we started, but at least I'm happy that whichever way it is growing, people should make it an academic thing, not a podium for advertisement or getting money or something, but still. Anything?
No, I think it was a very nice, long, interesting journey across.
Thank you very much.
Thank you.
Huh?
If he is there, we can just wait a minute. They don't look. It's always Rani coming back here.
It's so nice to see all our teachers coming and helping and giving interviews. It's a treasure, madam. Actually.
We owe a lot to this.
Actually, this institution has expanded so much that we should have conducted tour from time to time for
their
their
find
guys.
so much at every level.
मैडम का कंप्लेंट है
क्या
वो कॉलेज डे आजकल होता नहीं है क्या
होता है ना
काय झाला?
कॉलेज डे यू आर आस्किंग
College day we used to have. Now we hold on.
we are nice
At least every year we used to get invite. I never used to miss it.
फाउंडेशन डे सब
होते परंतु आम्हाला पण करत
Usually it's around
नाही.
December.
ईमेल होते सगळे आहे तो आपल्याला एक ईमेल तरी पाठवू
ईमेल
शकतो.
मध्ये पाठवत आपण त्यांना
काय नाही लई बंद झालं.
अपडेट करून घ्या.
Update.